All righty. Well, hello, everyone. Welcome to another edition of One Plus One, your place for inconvenient truth-telling and myth-busting, and happy Black History Month. And on the program, we welcome back our returning champion, Berneta L. Haynes. Berneta is a longtime lawyer who's worked in environmental law and eco-protection and is a practicing consumer law lawyer. She's also a sci-fi fantasy author as well. And in between both of those titles, she is a fantastic Black leftist, Black queer liberationist, feminist, and anti-imperialist. So who better to have on One Plus One when it's Black History Month than Berneta? So Berneta, welcome back to the show.
Well, thanks for having me back, and happy Black History Month.
Yes, and it's always great to have you. Oh, and of course, also one of our abolitionists who's been on the program, and yes, and also just a reminder, folks, please donate to One Plus One. We're totally independent media, so it'd be great if folks donated, and of course, to help us overcome the far right algorithms, please share widely new and past episodes of One Plus One. So Berneta, so let's get underway now. You actually suggested this topic, and I was actually hesitant at first, but relearning about this topic and its impact on the Black community, I had a chance to read some of what you actually some research you actually did about medical debt. So I'm actually really glad that you suggested this. So we're going to be talking about single payer healthcare and why and why it badly needs to be adopted in the U.S. So, so my first question then that I have to ask you is and this may sound like a stupid question, but actually explain to people what is single payer healthcare system. Talk about the American healthcare system or non-healthcare system. Feel free to even switch those questions and explain what advocates like you, when you guys talk about universal health care, why y'all advocate for single payer health care in the United States.
Yeah, so I think it's important to divide up two separate things here, and because I think this is where the confusion tends to start. There's single payer healthcare, and then there's universal healthcare, and
Exactly.
they're not necessarily the same thing, right? So single payer healthcare is a system where you have a single and individual payer. It may be a federal payer, like the government, or it may be national hospitals, actual like hospitals that are government hospitals. And so they're government funded, for example. So that's one version of single payer. You see that in the UK where all the hospitals are public government run hospitals. Okay.
Mm-hmm.
There's no middleman, essentially. There's no insurance middleman. And then you have the other type of single payer, like what you see in Canada and many other countries where there is a government funded health insurance, so to speak, that everyone has and they can use at any hospital, public hospital or such or so forth, that they want to use it at, or nonprofit hospital. We actually have single payer systems in the United States. We have Medicaid, we have Medicare, and we
And
have the VA.
exactly. In fact, that was actually my second question. So actually,
Yeah.
to explain what Medicaid and Medicare is, and before I ask my follow-up question.
Yeah. So we have these single payer systems already in our country. They're just not universal. They are means tested and limited to certain people. So for instance, Medicaid is available for folks who have disabilities and otherwise are not necessarily able to work fully or at all. Medicare is limited to those who have reached retirement age, right? And both of these are health insurance plans that are funded through the government directly. The government sets the rates that they will pay for certain services that doctors and physicians provide. And that's just the rule of the land. And those rates can change. They can fluctuate as the government does recalculations and determines that certain services should be refunded at a higher rate, for example. The VA system is another type of single payer system that we have. And those are an array of government-run, federally operated hospitals that are available.
And for our international audience, the VA is Veterans Affairs. So those are folks who have
Yes.
fought in wars, worked in the army, they get, basically get single payer health care. And
this is the Veterans Administration, Veterans Affairs department that runs these hospitals, and they're available for any folks who have given military service. I think there might be requirements in terms of how many years, for example, they serve, but I'm not specifically familiar with that requirement. But nonetheless, if you are a veteran and a former military veteran, you do have access to the VA system, generally speaking. You have access to the VA system in a couple of ways. You can use and seek your services at the actual VA hospitals, the veterans hospitals that are federally operated and exist in all various cities throughout the country. Or you can use the VA insurance elsewhere at another nonprofit hospital or private practice provider. And the VA system reimburses that provider at a rate that is set by the government for that particular insurance. So we have these already, but as you can tell, the single payer systems that we have currently, they're all means tested. You have to be within a certain demographic to qualify for these types of single payer options. There's also a couple of other ones too. There's the Indian Health Affairs. I can't remember the exact acronym. It is for those who are First Nations people and Indigenous folks who are citizens of individual reservations and so forth. I believe it's Indian Health Affairs or something like that. It too is another federal single payer system, so to speak. Indian Health Service.
Okay, interesting.
Yeah.
It actually now, there was a further question I wanted to ask you about Medicare and Medicaid, but I do have to ask this question, which is, why is it a single payer healthcare system has never taken off in the U.S.? It was never part of Teddy Roosevelt's progressive era, which was a good left-wing backlash response to the Gilded Age. Under FDR, the most popular ex-U.S. president to date, I would say probably one of the most left-wing presidents the U.S. ever had, who led the nation out of the Great Depression, never had a single-payer healthcare system be part of his sweeping New Deal reforms. And even under LBJ's Great Society and his war on poverty, what was missing out always was an explicit call for a single-payer healthcare system. And so my question to you is, why is that? And then the Medicare system, was that FDR that founded those, or was that actually LBJ when he did the Great Society? Your response.
Yeah, so I think a lot of history is very important here. Let's back up real quick just to make sure it's super clear what a single payer universal system is.
Yeah.
We're talking about, when we talk about a single payer universal system, we're talking about a publicly funded, I think that's very important here, a publicly funded versus privately funded insurance. It's a publicly funded national single payer plan that is administered at the state or local levels with all kinds of comprehensive lifetime benefits, dental, vision, mental health care, substance abuse, prescription drug coverage, long-term care, and so forth. That's what we're talking about. Ideally, when we're talking about the need for a single-payer universal healthcare system. Some single-payer universal systems don't cover things like dental or vision or long-term care. But nonetheless, we're talking about a publicly funded national single-payer health plan. What we have in the United States is mostly a privately funded health insurance system, where there are numerous health insurance companies that folks have to pay into directly through their employer or otherwise in order to have health insurance coverage, versus it just coming through taxes that are taken out of your paychecks, right? So going back to your question about Medicaid and Medicare, there's an interesting history around the creation of Medicaid and Medicare And understanding Jim Crow segregation is really, really an important part of understanding how these two came about, right?
Okay, interesting.
Yeah, so I want to back up because I think this will answer your question as to why we don't have a single payer system to some extent, and also why these programs are not enough, right? So before the Civil Rights Act was passed in 1964, and before the enactment of Medicaid and Medicare, Jim Crow segregation was really a big part of every institution in the United States, and that did not exclude hospitals, right? So in 1946, there was this sort of outcry about the shortage of hospitals that had been happening for a while, a shortage of hospitals and healthcare facilities after the Great Depression and World War II. And the Hospital Survey and Construction Act essentially codified hospital segregation. You may be wondering, what does hospital segregation mean? What does that look like? The Hospital Survey and Construction Act was also known as the Hill-Burton Act. It essentially authorized federal grants to states for hospital construction. So there's this big boom in hospital construction. This is really the era in the 1940s when we saw this proliferation of hospitals around the country being built. So although that act created this construction boom, essentially, that we'd have the biggest construction boom we'd ever seen for hospitals, it came with a very, very significant downside, that is Jim Crow. The act contained a separate but equal provision that allowed for racial discrimination in healthcare facilities and service. And they did this as a concession, essentially, to Southern political figures. So what we saw were Black communities in the South simply having no hospital available, simply lacking hospitals willing to actually serve them, right? And so we saw these high rates of infant and maternal mortality that we still see because of so many at-home births. In the northern cities, hospital segregation looked a little different. It wasn't that there was a lack of hospitals, per se, that would serve Black patients. It's just that the hospitals that were around, that were available to serve Black patients, were of inferior quality to some extent because maybe they lacked resources and materials, not large enough, for example. And so this just sort of entrenched Jim Crow segregation in a lot of ways in the hospital space. And we're still dealing with a lot of the repercussions of that Jim Crow segregation in the hospital space. Now, this is where Medicaid and Medicare come in to some extent.
Yeah.
Yeah. So there was this need to sort of figure out how to deal with vulnerable populations, particularly elderly populations. And the federal government created this program called the Medical Assistance to the Aged. MAA, I think was the acronym. And they created this to benefit some of these vulnerable populations, many of them, especially the southern states with lots of Black families. Many states underfunded that program or refused to participate outright, which is kind of familiar to today's issue where we have not seen full Medicaid expansion in the southern states. And I'll speak about that a little bit more later. But this is the connection and I think it's very important to understand why we are where we are today.
Yeah.
That program was implemented about 15 years or so after the act that created the hospital construction boom, right? It provided these federal grants to states to pay for medical services for poor older adults, poor older people. But the program, it didn't really take off. It was very slow to take off. Very few states actually began implementing the programs even 3 years after the passage of the act that was supposed to implement these programs. The main recipients of and beneficiaries of this program tended to be folks who lived in New York, California, Massachusetts, states that are more likely, even today, to implement protections for their residents. Apparently, there was a report, I think it was from the US Senate, a few years after this program was supposed to be implemented, that revealed that the southern states, Texas, Louisiana, Georgia, very Black states, didn't even have programs. They just simply did not implement any of these programs, or they made it so difficult to qualify for these programs. They means tested the hell out of them. So
Okay.
all of this effort to try to rebuild the country's healthcare system and make sure everyone has healthcare, that it failed for the most part. So we see another aspect of this great deal, this New Deal era kind of failing for Black people yet again. For a lot of us who know a lot about the New Deal era, we know exactly how so much of the New Deal didn't apply to Black folks. And this is just another thing in that New Deal era that certainly benefited white folks, but Black folks were still left again holding the bag.
Yeah.
And so eventually Medicaid and Medicare. And I'm going to stop because I know you probably have a question, because I do want to get to Medicaid and Medicare.
No, actually continue before I even do ask my question. No, continue.
Yeah, I like to give a good history lesson. It's probably because I was on the path to be a university professor at some point before I turned to law.
Well, this perfect show for history lessons, so go ahead.
Yeah. So you may be wondering, there were a lot of challenges to segregation in schools and so forth. So you may be wondering, were there challenges to segregation in healthcare settings? There absolutely were. There were lots of legal challenges to hospital segregation. In one case, that was really, really important for the Civil Rights Act in 1964, the Court of Appeals found that the separate but equal provision in that previous hospital act was unconstitutional. Of course, the hospitals appealed, but the U.S. Supreme Court basically declined to hear the hospitals appeal, basically making that appeals court decision final, stating that yes, separate but equal in hospitals is unconstitutional. There were debates about it on the Senate floor, especially as the Title VI rolled around in the 60s. People often cited this case in support of Title VI, Title VI being all about non-discrimination and so forth. And there were some definitely successful separate challenges that also cited that particular court case. And so this was a big turning point in the 60s. And this turning point in hospital segregation wasn't because of the Civil Rights Act of 1964, but because of the establishment of Medicaid and Medicare in 1965. Thanks to Lyndon B. Johnson.
Okay, perfect. Yeah, okay.
So I told you I didn't get to it. He did sign into law Medicaid, the acts authorizing Medicaid and Medicare, subjecting both of them to the non-discrimination requirements in Title VI of the Civil Rights Act. It didn't stop means testing from happening, but it did mean that to receive Medicaid and Medicare federal funds, hospitals had to admit Black patients or they would lose money. So in 1967, Johnson's Assistant Secretary of Health, I believe, that's not really important. The point here is that 95% of hospitals were admitting Black patients as a result of this. So once you threaten the money, you get some results, right? And that's what had to happen in order to desegregate hospitals to the extent that they are desegregated now. Although there's still a lot of problems, and the segregation in hospitals still lingers. We still have hospitals that the majority of their patients are poor Black folks, and a lot of those hospitals spend an exceptional amount of money providing charity care or free care to their poor patients. because they actually have to provide free care for their tax-exempt status. But it can put a real financial burden on those hospitals, because they still have to keep the lights on and all this. And I'm not trying to sound like a lobbyist for the hospitals, but when you have certain hospitals in well-to-do communities where almost nobody really needs free care, not having to spend very much money on free care at all and still keeping their tax-exempt status. And then you have hospitals in poor areas spending gobs of money on free care. You can see how there's this inequality that needs to be addressed. And it can't easily be addressed outside of a single payer model, if we're being honest.
That's
I'll stop there.
No, that's okay. That's fascinating, and so there's a new follow-up question that I have to ask you, but let me ask this one, which I prepared, which is which is about Medicaid. So
Yeah.
why hasn't everyone in the U.S. who are largely white working class and white precarious middle class, how come they haven't been expanded into a Medicaid system when, again, the U.S. is a country where the majority of people are actually are people who work low income jobs. They're paid below minimum wage, or they have a job that pays minimum wage, but certainly it's not enough to keep a rented roof over their heads. So they have to take one or more jobs. It's scandalous, but not unheard of teachers, notably elementary school teachers, middle school teachers, high school teachers, who are doing this, who have to do other jobs apart from their day job. So why hasn't Medicaid saved these people who often face financial ruins and find themselves because of medical debt in destitute poverty? Obviously, I understand the racism, and I understand the race. So I understand the racism. I forget calling it medical apartheid, new Jim Crow racism, good old-fashioned racism. So I understand why Black people, Indigenous people, and Latinx people, especially the more brown you are, would be excluded from a Medicaid system, even from a Medicare system, since they were actually excluded from all of those workers' rights that led to the New Deal and Social Security. But how come? How come in a country with so many working class, working poor, the white working class, even the precarious middle class, how come they, Medicaid just hasn't been expanded to them? I'm curious, your answer on that.
Yeah. I think it's a multi-layered kind of answer that I have for you, because on one hand, on a technical level, it's because the states have been given the option to expand Medicaid, but they haven't been forced to expand Medicaid. That is the difference between how Medicare operated when it was initially rolled out and how Medicaid operated when it was rolled out. So let me start with saying that when we talk about Medicaid expansion, what we're seeing is expanding eligibility for Medicaid. And there are many states that have never expanded eligibility for Medicaid, meaning that in those states, they have set the eligibility requirements so narrowly, have made it where you have to be so exceptionally poor to qualify that few people qualify. So you may think, I am an individual person, maybe one child, and I make, $28,000 a year or something like that, max, which is nothing. If we do the math on that, that is exceedingly small in the United States. It is definitely poverty. But in a state like Georgia, you probably won't qualify, white or Black or whatever, you won't qualify. So that's the technical answer. The broader answer is that the more that this country tries to limit Black access to social benefits, the more white people suffer as well. And that's really the broad strokes. What what they do to us always harms them at the end of the day, because it is okay in the minds of our elite, our ruling elite, white folks, it's okay to sacrifice some poor whites at the altar of maintaining white supremacy and capitalism. But then you'll look at states like Massachusetts, for example, or California, states like that, and you'll see that their eligibility requirements are much more generous for Medicaid. And this is not to say that people in those states aren't dealing with medical debt and still dealing with medical bills and so forth, but you might be more likely to be insured in those states through Medicaid because they're not requiring you to be so exceptionally poor to qualify for it. In Georgia, if I am not mistaken, if you are an individual who is not pregnant, let's see, you're not pregnant, you're not a teenager, you're not old, you're not 65 or older, you're not legally blind, you don't have a disability or need nursing home care, you're knocked out of eligibility anyway for the most part. Because no matter how poor you are, you're an able-bodied person who can work and get a job and get health insurance through your employer like everybody else. That's the idea.
In fact, just before I get to question 6, and in fact, it is Black History Month, so we do have to talk about white supremacy. But I remember watching an episode of Real Time with Bill Maher, where Bill had some people go to Mississippi, which is actually one of the poorest states in the country. Not just one of the poorest states in the South; it's one of the poorest states in the country. And they were talking with a guy who was literally a destitute former working class person who was just completely destitute, didn't have teeth or anything like that. And then when the crew asked him, well, don't you think that we should have a single payer healthcare system? And he basically said no. And then when they asked him, so you don't believe in Obamacare? He said no. And he was like, well, why would you believe in it considering your circumstances? And he basically said, oh, come on, this is that's for Black people.
Of course.
So
of course.
That's everything. So that's everything in a nutshell. So are a lot of white working class people, white middle class people, do a lot of them think that they don't even need Medicaid expanded to them, let alone single payer healthcare system, because I'm white, as long as I got my jobs, even if it's 2 jobs, that's enough for me?
Yeah, I mean, I think that is the way a lot of folks think. And it's nonsensical because you're essentially hurting yourself by having this kind of perspective that, oh, I'm not a lazy person, so I don't need that. Everyone needs healthcare coverage, right? But when we've associated these social benefits and necessities like healthcare with
special treatment
with something you have to earn and so forth, we create this mindset and a certain population that, well, I'm special, then I don't need these kinds of special handouts, so to speak. Like, I don't need someone to carry me. I can carry my own self. I can get my own.
That's how many people talk about welfare, in fact. So,
yeah, it's the same way that, healthcare gets talked about in a very similar way as well. Let me tell you how crazy it is. The way that people talk about healthcare coverage. In the fight to expand Medicaid in Georgia, to expand access to it, in other words, to increase the number of people who would be eligible for it, the federal government guarantees that if you increase the eligibility to a certain point, the federal government will pay 90% of what it costs to expand the system to folks, right? Whatever it costs for that state to get more people into the Medicaid system, the federal government will cover 90% of that cost if the state increases the eligibility access to a certain point,
Okay.
increases
Yeah,
income
yeah.
eligibility to a certain point, right? So literally a state can't lose in this way. They only have to pay 10% of the cost of getting more people into the program. This is like a win-win. You think, why would I not say yes to this? And that's the question. Why would I not say yes to this? So we tried and tried in my old position to, emphasize Georgia will not have to cover more than 10% of the cost of getting more people into the system. Are you understanding? Just expand, increase the eligibility to this amount income wise. And like literally 10%, that's it. It's like the cheapest thing. Well, we're gonna have some people who just don't want to work, and coming up to the hospital in a Hummer, getting free healthcare. I've heard these kinds of comments from folks in politics, in the Capitol here in Georgia.
Wow.
And you think to yourself, on one hand, you're like, no, they're not going to be driving a Hummer up to the hospital to get their free health care. On the other hand, you think, who cares? Shouldn't everyone have access to health care? Don't you want a public that is generally healthy? One unhealthy person with all kinds of potentially communicable diseases can make for a very unhealthy population generally, can spread to other folks. So wouldn't you want to make sure that everybody is healthy as much as you possibly can? Anyway, who cares if they come up to the hospital in a Hummer? What kind of silly comment is this?
It's especially, well,
Yeah,
especially if the job that they have can only means that they can only even afford something like that. But that's just so ridiculous.
it's a ridiculous thing, but I've heard exactly that statement. Some people will just choose not to work, and so forth. And you think to yourself, well, again, what does it matter? First of all, they got other bills to pay. It's not like healthcare is the only thing. They have other bills they have to pay, so they're probably going to work. And if they literally can't work, then they're covered healthcare wise. So everybody's winning here. I don't really understand the arguments that are made if I try to think about them in terms of let me see if I can appeal to this person. If I try to think about them that way, because I recognize that deep down, when they're talking about some people, they're always talking about Black folks. This always comes back to Black people. It's certain people who are going to mooch off the system and be lazy and not work. And it always is Black folks that they're talking about in a coded way. I have had conversations with social workers in clinics after giving a seminar on medical debt or something like that. And I will, end off with, the way to solve this problem really is single payer universal health care. And then social workers be like, well, what about the people who come up here and, in their fancy cars to get, their free health care then? And all I'm thinking is, you're a social worker. Shouldn't you actually be able to think beyond that and realize the broader ramifications of some people not being in?
Yeah, it's basically all about. It's basically all about equality and how some people just even reject that. It doesn't matter whether it benefits
Yeah.
somebody who's already rich or somebody who's poor and is in need of it. It's simply that healthcare is a right. But that's just unbelievable. But then
So
I have to
it's
ask you.
it's really incredible. I'm telling you, it's incredible. And that number that I gave earlier, about how poor you might have to be in order to qualify for Medicaid health insurance. I'm not far off the mark. If you look at what they call the federal poverty level guidelines, which is what they go by
Yeah.
to set these income eligibility requirements. If you're at 125% of the federal poverty level and you're two people, say it's you and a child in your household, that means you make 25,500 and no more. So if you make more than that, in some states where they've set the eligibility at 125%, you won't qualify for Medicaid. So
Unbelievable.
it's unbelievable. And if you're an individual person, say, and you make above 18,000, that's 125%. of the federal poverty level, you won't qualify. And I will say again that in Georgia, they not only require that you be low income, you have to be low income and you have to be either pregnant, uh, currently have cancer, be a child under the age of 14 or 18, I should say, 65 years or older, blind, have other disabilities, or need nursing home care. You can't just be low income in Georgia and qualify for Medicaid. You have to be low income and in some other way disabled to some extent. All of that just to get health coverage.
That's crazy. And in fact, that leads to this question, which is now in the U.S. There are some people in which their jobs provide them health insurance, so that hypothetically, if someone ever has to go to an hospital for an operation because they've been involved in an automobile accident or they have cancer or other life-threatening diseases, they need to be taken care of. Generally, the employer will pay the bill. Can you explain this and why it's often been a huge nightmare, not only for the company, but it's actually been most troublesome for the employer patient when it comes to getting medical help?
Yeah, so in those cases, it's not that the employer will pay the bill. So it's very complicated. So the employer pays for a particular group plan for their employees. And it's usually egregiously expensive for the company, these group insurance plans. And then as part of that group, as an employee who is a participant in that group insurance plan, you then have a premium you have to pay that comes out of each paycheck, right?
Oh, wow. Okay.
And it can be an extensive amount of money. And then on top of that, you have a deductible you have to meet before your insurance will pay in full for the service. So what you're looking at is a large pot of money that the company itself has to pay for that group insurance plan for its employees. And then each employee who chooses to use that insurance and participate in that insurance has a particular amount of money come out of their paycheck every paycheck. For example, if it's just you on that insurance, you may have let's say you have $150 coming out of each paycheck. If it's just you on that insurance, right? 3 paychecks or whatnot, and you're looking at, 300 and 400 and something a month, right? As a premium. That's in addition to what the employer has already paid this insurance company to even let you be part of this plan, okay? Then, in addition to your premium that you're paying through every paycheck, you have a deductible you have to meet. There are some very high deductible plans. There are moderate ones, and then there are very low ones. A low deductible plan would be like having to pay out of pocket $500 throughout the entire year before the insurance will kick in and pay 95 or 100% for the service, right? A high deductible plan could be literally you have to pay out of pocket $6,000, $5,000, $10,000 that year before your insurance plan will kick in and cover 100%. So let's say
okay, so Berneta, before we were cut off, you were explaining how the whole health insurance through an employer works, and why it's been a huge nightmare, not just for the employee, but for the employer. Feel free to start from the top again, because unfortunately, the power got cut off at your place. So go ahead.
Yeah, we got a lot of grid problems in the United States, and that's a whole other topic. But yeah, so the way that I know it's unbelievable, and it's especially bad, I think, in the South, I feel. But the way that it works with employer plans compared to a publicly funded national plan or single payer plan, for example, is that your employer pays this large amount of money, a very, very large amount of money, to buy into a group plan through a private insurance company, Cigna, United Health, or so forth, right?
Yeah.
And then They buy into that group plan, and this literally can be a majority of an employer's actual budget, just covering the insurance.
Wow.
Um, this literally can be a majority of an employer's budget and overhead. And so you, as an employee, then are allowed to participate in that group plan, right?
Yeah.
You can choose, because we have Obamacare, you can choose to go outside that plan if you want, but you can choose to use that employer's plan, and most people do. That means if you sign up for that employer's health insurance plan, that a certain amount of money is going to come out of each of your paychecks to cover you. And if you add a family member onto it, even more money is going to come out of your paycheck. For example, for my husband, when he was individually covering, having himself covered through his employer plan, which he didn't need because he actually has the VA coverage, but his employer required that he have this plan.
Okay.
It was costing about 100, I think, and 50. I think 150 or something like that, just for him alone, each paycheck. If you're thinking 3 paychecks or so a month, then you're looking at like, about 300, 400, that kind of thing a month, for one person. And this means you have an insurance coverage that if you need to go to the doctor, you have an insurance card. That insurance company has a negotiated rate with that doctor. And so when you go to see that doctor for a service, that doctor bills the insurance directly. The insurance covers what they have negotiated to cover with that doctor. Got it? That's how that works.
Yes.
Yeah.
Yeah. Continue.
That's how that works. Now, every private insurance plan has a deductible. All of these plans have a deductible. By deductible, we mean the amount you have to hit in terms of out-of-pocket costs, in terms of what you pay out of your pocket before your insurance will kick in and 100% cover things that you need. Now, let's say the easiest way to understand this
Yeah.
is, let's say you're a pretty healthy person.
Yeah.
So you don't go to the doctor very much, and you have a deductible of, let's go with $3,000. That's kind of high, but not terrible high like some can be. That means that other than the types of care that are called preventative, that are always going to be completely covered, and that's like your routine physicals and things like that. Other than those things, you're going to be paying something, right?
Yeah.
You're going to be paying something because you haven't hit your deductible yet, right? So if you go to a dermatologist and they treat you and that provider charges or bills your insurance, I don't know, $700. You will likely be on a hook for that $700 because you haven't hit your deductible yet, right? Now, if you did that a few times that year and hit your $2,000 deductible, then everything else that you need for the rest of that year will end up being covered by the insurance. It's a really, really weird scheme.
It's
Some
it's
people have some
it's
people have good plans where their deductible is 500, so they hit their deductible really easily, even if they're healthy, right? The deductibles make a lot of sense in some ways for people who have massive emergencies that happen. Um, Something really big happens to them, and they have to go to the emergency room, for example. And I don't know, it ends up being that your insurance is billed 15, 20, 30, $40,000. Well, if your deductible was 1,000 or 2,000, you've hit it anyway. And so all that you'll end up paying would be that 1,000 or so instead of $80,000, right? This
wow.
is how they sell it to people as a good idea, right? It doesn't have to exist, but this is how they sell it as a good idea. But the truth is, a lot of people, for just their regular care and regular doctor's visits, they're never going to hit their deductible. And
Yeah.
so they end up paying out of pocket the whole year. And then the clock starts over. Let's say you get close to hitting your deductible, but you just miss it. You just miss it. Well, that clock starts over in the next year, in the next cycle. So yeah, it's not like it rolls over.
It's quite it's quite a mind f, and
It's totally a
So,
mind. It's
so
totally a mind fuck. It's totally a mind fuck. It doesn't, I think to anyone outside the United States, you're like, what the hell are you talking about? And I would agree. What the hell are you talking about? My husband is
but,
a
but, but,
veteran.
but that's a perfect segue then for that's a perfect segue then for this
Yeah,
question is why are so many people those okay. So it's one thing if you
yeah,
don't have any health. So it's one thing if you don't have any health insurance because you're not working a job that provides health insurance,
uh-huh,
and if you do a low wage job like working at
yeah,
I guess 7-Eleven or you're working at McDonald's
uh-huh,
or you're working at a restaurant or whatever quote unquote small business. Okay, so you don't have health insurance, and anytime you go to the hospital, whether it's
uh-huh,
you have a cold or whether it's for something very very serious like pneumonia or
yeah,
automobile accident or life threatening disease, uh,
mm-hmm,
that person is either going to be treated, but
mm-hmm,
basically is going to be in financial ruins afterwards because of medical debt, or
yep,
they're simply not going to be treated. So
yep,
so
that's
the big
it.
and then that's
Mm-hmm,
scandalous. That's already
mm-hmm,
scandalous. But then
mm-hmm,
all of those people who do have health insurance, why is it that so many people, those who do have health insurance, from
mm-hmm,
their
mm-hmm,
employer or they've managed to get health insurance from their from directly from a private health insurance company, as is often a scandal when the person or their child or their loved one
uh-huh,
find themselves in need
uh-huh.
of medical attention, the insurer doesn't pay for their medical costs. And
Oh, yeah,
so,
uh-huh.
so explain that, and which administration is to blame for this standard, or is
Uh,
it, or has this been an issue in the U.S., a bipartisan issue throughout the U.S., starting, I believe, in the hospital in the late '60s, which again
yeah.
mostly took care of white people of all socioeconomic backgrounds. They did operate
Mm-hmm.
free clinics, but
Mm-hmm. Mm-hmm. Mm-hmm.
actually, actually, the free clinics.
The
Let's
free
talk about
clinic
that a bit.
thing is Black, yeah. Black Panthers kind of came up with that. So yeah.
Exactly,
That's
exactly.
I think like, yeah, let's, uh so
So
but that's a
explain
whole
that to me.
other, so you're hitting the nail on the head. On one hand, it's the number, it's a sheer number of people who are uninsured. They have no coverage at all. And they're going to the hospital for even small things that would be tiny, tiny cost in most other countries that are exorbitant cost here in the United States.
Yes.
Because our insurance industry is privatized in a way, in such a way, it enables the cost to be so high as well for various services, right?
Yeah.
Versus if all of this is very important because our insurance is so privatized. It allows for costs to be really, really crazy for various hospital and healthcare services. Versus if it was actually publicly funded, our insurance, the government is only going to pay so much. So they're going to keep the cost low. That's just the way this works. So on one hand, you have all these people who are uninsured, and as soon as they go to get even just the most moderate thing treated, they're looking at $10,000 potentially. Um,
Unbelievable.
and if they're low income, even if it's just $800, it's throwing them into a financial tailspin. Even if it's under 1,000, right? And and then you have the people who are insured that you would think, oh, well, they shouldn't have this problem, privately insured, I should say, because those who are publicly insured don't have these problems the same way. Folks on Medicaid don't have these kinds of medical debt problems. Folks who have VA coverage, Veterans Affairs coverage, they don't have these kinds of problems. But folks who are privately insured through their employers, they end up running into the same kinds of medical debt issues because of high deductibles, and also because of insurance being out of network, which is a whole can of worms. You have to make sure that you go to providers that are within your insurance network, meaning your insurance has negotiated a rate and agreed upon a rate with that provider previously to you seeing them, right? There are these very narrow networks. Some places in this country, folks have to drive 100 miles to get to some provider that's within their network. There are
Yes.
entire
Yes.
counties,
Yes.
there are entire counties in Georgia where there is not an OBGYN, where folks have to go clear out of town to get to an OBGYN at all, and maybe even further than that to get to one that is within their insurance network so that they don't end up paying super high cost. Because if you go out of your insurance network, you're looking at exceptionally high costs because your insurance isn't going to cover that provider, or they will cover that provider at a lower amount because they have no previous agreement with that provider.
And because of this ridiculous, it really is ridiculous privatized healthcare racket. Is
Yes.
this why? Is this why even people who do have insurance, if they get if they develop if they develop diabetes, or they develop Crohn's disease, or they have irritable bowel syndrome, is this why so you have a plan, you have this healthcare plan, but if you get a new disease, heaven forbid, a cancer, or you have IBS, or you have Crohn's disease, or something like that, is this why, because it's so privatized, why a lot of health insurance say, sorry, that's not in our plan?
Well, that was the case actually before Obamacare.
Okay.
One very important thing that Obamacare did do was make it essentially illegal for insurance companies to discriminate on the basis of pre-existing conditions.
Exactly.
For example.
And you want to explain to our audience, our international audience, what this
because
ridiculous thing of
essentially
everybody was.
Essentially everybody will have a pre-existing condition at some point. Living is a pre-existing condition, but essentially a pre-existing condition is, say, a particularly chronic maybe condition that you have. Literally, it could be pregnancy that you have previous to getting that to enrolling in that insurance, for example. And so they decide that any kind of treatments you need related to that, they're not going to cover because that existed before you enrolled in their insurance. Literally, pet insurance does this, by the way. And some insurance companies will outright refuse to actually cover a person that has pre-existing conditions. So not only will they not cover a certain service, you may just never be able to get insurance through them. That was the case before Obamacare. Before Obamacare, there were people who could not get insured because they had pre-existing conditions. Strangely enough, pet insurance operates like this. If you have a dog that has, let's say, a liver problem, and you go to try to get them pet insurance, it's a lot of pet insurance companies that won't even bother, insuring that dog because they know they're going to have to pay out because that dog has complications already, issues already. So it was very similar with humans before Obamacare, essentially, with our insurance.
And under which administration actually started this, or was this always a bipartisan issue? Because again, single payer healthcare was never ever given to to Americans during the progressive era under Teddy Roosevelt, or the New Deal era under FDR, and even under LBJ's Great Society, in which one would think Medicaid would have taken care of all of that.
Yeah. And to be clear, universal single payer was never on the table. Single payer was on the table and did get created in the form of Medicare, in the form of Medicaid, albeit limited, and the Veterans Affairs Administration, Indian Health Service, but just not universal single payer. But in terms of this, the insurance issue and like how some of these developed, I wish I knew more about the history of our insurance, the political history of our health insurance industry, because I'm sure it's very seedy. I just know a lot less about the history of our private insurance industry. But I can tell you that Medicaid and Medicare were the first times this country decided that some sort of single payer system needed to be implemented. They just decided it needed to be means tested. That's it.
And actually, just before we wrap up, two questions before just before we wrap up. But I do have to mention this. So, starting in the U.S., I believe it was in the late '60s, hospitals that even mostly took care of white people of all
Yeah.
economic backgrounds started to operate free clinics. But what people
Yep.
don't realize this actually
Mm-hmm.
is what people actually don't realize is actually the very first free clinics were actually
Mm-hmm.
started by the Black Panther Party and the Young
Yep.
Lords, which was a Puerto Rican
Yep.
Marxist left wing group, very similar to the Black
Uh-huh.
Panthers and the American Indian
Mm-hmm.
movement and the Chicano militant leftist groups. They
Mm-hmm.
actually took over a hospital in New York that had been practicing
Mm-hmm.
various forms of medical apartheid and
Mm-hmm.
demanded the racist practices stop. And during their takeover of the hospital,
Mm-hmm.
they actually began to practice free clinics, and they actually demanded that the hospitals practice free clinics given to the Latino community, not just
Yeah.
in that particular hospital that they took over, but other branches statewide,
Yeah.
nationwide, where Latinx folks
Mm-hmm.
would be given proper medical treatment and treated equally.
Mm-hmm.
I'm
Mm-hmm.
yeah. Yeah, so
That's the, and that
I'm curious to
first of all, I think that is such a good note to end on because that's the kind of shit that honestly has to be done. At the end of the day, the more that I work in this space and I think about all the band-aid solutions that we come up with to try to make sure that people don't go bankrupt because of medical bills and so forth, the more I realize that not only is a single payer free system important, and it's not free, it's coming through your tax dollars. But not only is a single payer free system important, but probably the only way we're going to get it is through those kinds of old school methods that we saw that the Black Panther Party and the Young Lords implemented because they realized ain't nobody else going to do it for us. And we have so many educated people out here with the skills, with medical experience, with medical expertise and degrees and so forth. We have so many doctors out here who would love to be able to actually help their patients, but they have to navigate this horrible labyrinth of insurance that makes no sense and that ends up leaving a lot of their patients out in the cold. So, with all the kind of experience we have and people we have in this country that could definitely um, provide the services necessary, we don't really have any excuse not to implement the strategies that the Black Panther Party used and so forth. We don't have any excuse anymore.
in fact, what's crazy is again. So it was the Black Panther Party that actually operated the first
Mm-hmm.
free clinics, and sadly, as
Mm-hmm.
a COINTELPRO, because of the state
Mm-hmm.
terrorism that was inflicted on the Black Panthers, a lot of
Mm-hmm.
the Black Panthers basically couldn't operate
Yeah.
anymore. So what they did is they actually just basically gave a lot of their free clinics. They gave
Mm-hmm.
that over to local hospitals and whatnot.
Yeah.
Uh, and there are still some hospitals in which poor black folk and
Yep.
other people of colors are practiced. But the very things that you were talking about, how punitive Medicaid is practiced, and how still to this day, even when you do go to public local hospitals, black people and other people of color are still treated like shit and not
Oh
given
yeah,
proper.
yeah. The quality of care is that's a whole other can of worms, but absolutely. Yeah. At any of our hospitals. Yeah. And
So
we're paying for bad treatment. That's the crazy part of it. We're actually paying all this money and going into debt for poor quality healthcare, in a lot of cases, because we're not listened to as Black folks. Whole separate topic though, that one.
exactly. But we are going to return actually to that topic. So join us, folks. We'll this is part one of our conversation about healthcare in the U.S. and the desperate, urgent need for a single payer healthcare system. Berneta L. Haynes is our guest to explain that. Yes, so please join us for part two. Hi, everybody. Welcome back to part two of my conversation with Berneta L. Haynes on all things single payer and the U.S. Healthcare system. And again, happy Black History Month to everybody. And yes, and this is our Make Me Want to Holler edition, which is all things Black people in the U.S. Well, internal island Britain, but yes, the United States and Canada and elsewhere. And yeah, so yes, so let's get back to our conversation. So Berneta, so you were explaining, I think you did a very good job explaining the rackets that is the the health insurance system and how and why it's why it's a nightmare when employers take care of their when employers take care of their employees' healthcare coverage, but also the whole minefield of of the deductibles and so forth. And we were also talking because it is Black History Month that the very first free clinics were actually started by the Black Panthers and the Young Lords, and sadly, when state terrorism was inflicted on all of those people power groups, the Black Panthers had to actually give up a lot of their free clinics, but they gave it to to the local hospitals, which continue to perform versions of a free clinic for the very needy and the destitute and so forth. So that's a good segue now to this question. So explain to us this. What was the Clinton healthcare reform bill which was defeated? Because it's very common. It's very common amongst the single-payer healthcare movement, which is one of the longest social justice movement the U.S. has ever seen, to say that the Bill Clinton Al Gore administration was promising a single-payer healthcare system. We know Hillary Clinton was heavily involved in trying to draft and come up with the legislation, which, to the despair of single-payer healthcare advocates and others wanting a just healthcare reform, it was defeated in the Republican-controlled House and Senate. That's at least how it was explained to audiences in Michael Moore's documentary Sicko. But I recently was watching the MEF-produced documentary The Myth of the Liberal Media, in which Professor Noam Chomsky, the late Edward S. Herman, authors of Manufacturing Consent, The Political Economy of the Mass Media, and media critic Justin Lewis of the University of Massachusetts, though I think he's long changed, where he's working. But they all argued that the Clinton healthcare bill was not single payer, that it was a corporate friendly, business friendly reform in which there was room for government involvement, but it wasn't the single payer healthcare that folks like you and the anti-profit movement were advocating. So take us back to the 90s. What was Clinton's plan, and what was Bob Dole's healthcare plan, if you have any knowledge of that?
Yeah, well, unfortunately, my knowledge of both of those is pretty scant. What I do know about the Clinton healthcare plan is that it sounded a little bit like what we ended up getting with the Affordable Care Act. But again, I'm not as familiar with this, so take this with a grain of salt. But what I do know about Bill Clinton's healthcare plan, I forget what the name of that bill was that the idea was that everybody would have like health insurance. Like there would be a healthcare insurance card in everybody's hand, right? And essentially every citizen would have this health insurance coverage. And it would either be through like a separate program from their employer or through their employer. And any employer would be mandated and required to offer health insurance to their employees if they had like over 5,000 or something like that employees, full-time or I think full-time. And there would be subsidies for people who are too poor to actually afford the coverage outside of their employer plan. So everything that I know about it kind of is limited to that. And from what I can tell, that sounds like what we ended up getting through the Affordable Care Act, which was that.
Interesting, and actually funny enough, although John McCain and a lot of Republicans were mocking Hillary Clinton's healthcare bill as being way too complicated, way too many pages, there actually is a lot of truth to that, because many critics of the left said that it was very much not what single payer healthcare advocates were advocating.
Yeah.
It was too much of a business friendly, but the government's subsidized program. Hence why hence why it was so overly complicated and why it was. Well, the Republicans were going to defeat it anyways, just out of sheer immaturity and political spite, which is what we know the Republicans to be for. But anyways, it's very interesting.
Yeah, yeah, and it's some of the same arguments that we saw around the Affordable Care Act as well, which is that from the left, which is that it was too business friendly. It wasn't this universal program that they were touting it to be, because folks still had to buy into coverage instead of it being just something that is granted to us and paid through our taxes, which is what you see with universal public plans in other countries. I don't remember if there was any sort of like tax penalty type of thing involved with their plan compared to the Affordable Care Act, because that became a real sticking point with the Affordable Care Act, especially for people who were against it, is that oh, I'm going to be penalized come tax season if I just go without healthcare coverage. It just became a real easy hook for like Republicans to rail against it, and for some people even on the left to rail against it. But what I do know about the Bill Clinton plan is that it was very moderate, very business friendly, and not all that different from the Affordable Care Act, which I will say the Affordable Care Act was important in a lot of ways, the way Bill Clinton's plan would have been had it succeeded.
Well, before we actually talk about the Affordable Care Act and Obamacare, that's perfect segue to this question, which is, what was the Romney healthcare plan in Massachusetts when Mitt Romney, a Republican, was governor of the state of Massachusetts, which overwhelmingly tends to vote Democrat? But the Democrats in charge, they often tend to be, corporate Democrats, not the Bernie Sanders, old school FDR, LBJ types. So, do you know in Massachusetts? Do you know anyone in Massachusetts which is actually happy with it, or only folks who say it's junk? And then, of course, they continue, and of course, they make the case that it's not a single payer system.
I haven't heard anyone say it's junk per se in Massachusetts, and I do have a lot of colleagues who are based in Massachusetts. Romney-Care was pretty much almost bar for bar the same as the Affordable Care Act in a lot of ways. They had the state-based exchanges where people could buy coverage through those exchanges. They had subsidies for people who were looking at coverage through those exchanges but couldn't necessarily afford them. So if you were low income enough, I think they were very generous with the income eligibility rate, but the Affordable Care Act is even more generous with the eligibility income level for access to those subsidies. Romney-Care had the mandates for businesses to purchase insurance if they had a certain number of employees or face a financial penalty. So similar to the Bill Clinton plan, similar to the Affordable Care Act. But from my understanding, the differences with Romney-Care and the Affordable Care Act really comes down to the sheer number of people that participate in it. Like obviously Massachusetts is small, for example. And then also two more things were really important in terms of the differences. One is Medicaid expansion. I'll get to that in a second. Cost sharing for routine preventative care is a big difference between the ACA and Romney-Care. So the ACA, the Affordable Care Act, or Obamacare, requires insurance policies to cover preventative services. That includes like physicals, cancer screenings, things like that, with no co-pays or deductibles. Now, they try to get around this kind of thing because I recently ended up with a copay for a routine physical, and I still don't know why. But the Affordable Care Act requires that to be covered entirely with no cost sharing. So cost sharing being copays, deductibles. Everything else has a copay. Everything that's not a preventative care type of thing. The Massachusetts law, Romney-Care, allowed for copays for preventative care. So that was a very big deal. I remember Obama touted that a lot in the push for the passage of the Affordable Care Act. that routine preventative care would be covered fully, no out-of-pockets. Medicaid expansion is the third difference between these two, between the Affordable Care and Affordable Care Act and Romney-Care. So in Massachusetts, Medicaid was already expanded and available for kids and parents and pregnant people, folks who are unemployed long-term. The Affordable Care Act, though, was an opportunity to expand Medicaid in states that had not expanded Medicaid. So you remember the other day in our first conversation, we were talking about some states that have refused to expand Medicaid, meaning they have kept their Medicaid eligibility really narrow and strict so that very few people are eligible for it. The Affordable Care Act included a provision that would pay 90% of the cost of a state to expand access to Medicaid if they expanded up to a certain income level. So if they increased eligibility by a certain amount to get more people into Medicaid, under the Affordable Care Act, the federal government would cover 90% of whatever it costs the state to do that expansion. That wasn't necessary in Romney-Care because they'd already expanded Medicaid. So those were a few of the major differences, but really they were the same plan for the most part. One was just covering fewer people because it's just Massachusetts. Another didn't require any payments for preventative care, and the other included Medicaid expansion. Like that's it. Those are the biggest differences.
That's fascinating, and that's exactly what my follow-up question was, which is explain now fully what was the Affordable Care Act or Obamacare, and why again it's not something leftists should celebrate. It's not something, if you're an FDR, LBJ liberal, you should be celebrating, and explain how contrary to Republicans and the even more far-right MAGA-type Republicans who claim it was socialist reform, why it was not socialist reform, and explain how actually, when you study and examine it, the ACA, Obamacare, was really a version of Romney-Care, or the right-wing healthcare plan that the Heritage Foundation championed when Bob Dole was running for office and suggested that the Clintons adopt. You already sort of touched about it, but yes, yeah. Please do answer more.
Yeah, so the Affordable Care Act it's very complicated talking about the Affordable Care Act because there are some positives, right?
Yeah.
To the Affordable Care Act. We certainly had fewer people going without coverage after the Affordable Care Act was implemented and put in place. We certainly saw fewer people or no people being uninsured because they had a pre-existing condition. I think a lot of people, probably those of us who are younger, which includes me, don't realize how bad it actually was before the Affordable Care Act if you had what's called a pre-existing condition. Yeah. If you had a chronic condition, trying to get insured was, as we discussed in the first conversation, was very close to impossible. And so you were just kind of left hanging. And it's this sort of no man's land. They call it, advocates often call this the coverage gap, where you're just sort of left in the middle with no coverage and trying to figure out what to do. So the Affordable Care Act did reduce or damn near eliminate those kinds of reasons for why people weren't covered, having a pre-existing condition being a reason for lack of coverage. It did not solve the problem of lack of coverage entirely, however, and there are a lot of reasons for that. On one hand, the insurance that folks could purchase in the marketplace in the state-based exchanges, so the premiums could be quite high for some of those. And what we saw were a lot of plans that had very high premiums and very high deductibles for folks. Now, if you were low income enough, you could get a subsidy to cover your premium and so forth. But you had to, again, be low income enough to be able to qualify for that. And some people may have just lost a job and weren't quite, low income enough if you look at their bank accounts and so forth to qualify for that, those kinds of help, grants and subsidies. So a lot of people end up choosing not to buy any health insurance because they can't afford the premium. When you're looking at $1,000 a month potentially for your health coverage, you may just say to yourself, I'm not doing this. And especially if you're paying $1,000 a month and you still got a $10,000 or $5,000 deductible that you have to hit that year before your insurance will actually really kick in. Meaning the only thing you can go to the doctor for and not have to pay out of pocket for would be preventative care, like a physical or a cancer screening. Everything else you're going to be paying out of pocket. So we ended up with a situation where, yes, we have more people covered than ever before with the Affordable Care Act, but we still had this alarming number of people without any health insurance, and some people with health insurance that just wasn't good enough, that they were paying an exorbitant amount of money for, and that was barely covering what they needed it to cover. I live in a state, Georgia. I live in Atlanta. In
a red
Atlanta,
state on top of that.
Yeah, a red state. Some people consider it purple because it went for Biden in 2020, which felt like a fluke. But maybe it is purple. I should say there are red states, but pretty much all cities are blue, and I think that's always very important to keep in mind.
Yes,
always.
Yeah.
But Georgia for the longest time has been consistently like in the top 3 at one point for the most people without health insurance. You may be thinking, well, if Medicaid expansion was part of the Affordable Care Act, shouldn't that have like resolved the problem of lack of insurance for poor people? The problem is they left it up to the states to expand Medicaid. They left it up to the states. And what we had and still have was all the blue states expanding Medicaid and many of the more moderate states expanding Medicaid, and then the reddest states refusing to expand Medicaid. Most of those red states being in the Southeast, which is also where the majority of the United States Black population is clustered. So what you had was a situation of continuing Jim Crow in our healthcare system, just not called that. And that's why I spent so much time the other day harping on about Jim Crow segregation in healthcare, because it continued. And what we saw during Jim Crow segregation in healthcare, official Jim Crow segregation in healthcare, was that it was Southern states where there was just this general lack of access to healthcare, period. Not just access to poor quality healthcare, just lack of access outright. And what we've seen is that there's a continuing legacy of that in the states that have refused to expand Medicaid. So as I was saying the other day, it is extremely difficult to qualify for Medicaid in the state of Georgia because Georgia still hasn't expanded Medicare under the Affordable Care Act. You have to be poor plus disabled in some way, plus poor, or plus a child. You have to be poor plus things. You can't just be poor and be viewed as entitled to healthcare in Georgia. And that's true for most of the other states in the South, with the exception of Louisiana, my home state, Arkansas, and most recently, North Carolina, as well as Virginia. The rest of the states in the South haven't really expanded Medicaid. I think Kentucky did, though. I think Kentucky was one of the earliest states to expand Medicaid, along with my home state in the South, which is funny when you think about it, considering that that is about as red as it gets, Kentucky.
Quick follow-up. What about what about a very large populous state like Texas, which people would be shocked to know this? Texas gets this stereotype as being completely far right and backward, but actually before George W. Bush was actually governor of Texas, Texas had a female governor who actually was a Democrat. And so do we see the same kind of dynamics in a place like Texas, or does Texas kind of do Romney-Care style of politics and healthcare?
Oh, hell no. Texas would not. Texas is as far from Romney-Care as they will. They are. When I talk about the red states' refusal to expand Medicaid and there being a cruelty at the heart of it, quite honestly, Texas kind of embodies this.
Okay.
Texas is a unique one in a couple of respects too. Texas had congresspersons at one point who were trying to figure out how to expand Medicaid using different levers than the Affordable Care Act. They were trying to find different ways to expand it. And could it be expanded at the city level and things like that? Because it's so difficult to get anything done in Texas that would benefit poor people and that would benefit people of color and so forth. And it is important to note that the folks most impacted by how jacked up our healthcare system is in this country is 100% Black Americans.
Okay.
The indigenous community in this country and the First Nations community struggle as well when it comes to healthcare access, but Black folks, followed by the Latinx population, are the most impacted by the lack of healthcare coverage and the lack of adequate coverage. Texas is a great example of a state where if you are poor there and you just cannot afford to purchase a plan on the state exchange, you're just kind of screwed in a lot of ways. You're much better off just moving next door to my home state, Arkansas, if you want to be able to get some coverage. So Texas has done probably one of the worst jobs in the country. I said one thing about Texas that I will just very quickly say, emphasize, is that Texas is a little unique in one particular way. Texas has, I think it's Texas and Nevada, two ways that Texas is unique. Texas and Nevada have more for-profit hospitals than nonprofit hospitals.
Wow.
So every other state in the country, the majority of the hospitals are nonprofit. That's very important related to the Affordable Care Act, because the Affordable Care Act has very specific provisions that nonprofit hospitals have to follow related to offering free care to people, charity care it's called. It only applies though to nonprofit hospitals, that part of the Affordable Care Act. So Texas is a state that has more for-profit hospitals and nonprofits. So a lot of hospitals aren't even subject to the Affordable Care Act's specific requirements related to free care there. The other thing that makes Texas unique is that Texas has a lot of military hospitals. And Texas, in some parts of Texas, the only trauma unit or emergency care unit may be a military hospital, meaning a government-run hospital. Meaning, if you are seen there and your insurance doesn't cover certain parts of what you're seen for, you end up getting a medical bill that you can't pay, and then you're sent to collections. But you're not sent to collections where a private attorney is contacting you to get you to pay this bill. No, the Department of Treasury is mailing you about the debt you owe. And the Department of Treasury has very, very unique powers to collect on the debt, far more power than a private debt collection company has to collect on the debt. It is very difficult to fight a debt collection action when it's the Department of Treasury that you owe. So
welcome to neo-Keynesian politics, folks, and neo-Victorian stuff. And
so
that's actually
that's in the weeds, but I just wanted, since you mentioned Texas, I just wanted to make sure that that's clear, that Texas has even more of a crazy set of problems related to healthcare than some of the other states do.
And thanks for that. And actually, now during the healthcare debates when Obama took office, within 5 months or so, he tried to pass what became, what became the Affordable Care Act, or Obamacare. A lot of that, I think, it was thanks to Michael Moore's film Sicko, where it really reawakened the single-payer movement. Democrats like the Honorable Dennis Kucinich of Ohio, twice when he ran for the Democrat nomination for president. Damn shame he didn't get it. He was gagged repeatedly when he ran on a single-payer, non-profit system, and sadly, when he tried sadly he tried to pass twice a single-payer healthcare bill, but it was either defeated or just didn't get the amount of sponsors needed for it to even be debated on the floor. During all of this and some of the town halls debates, we began to see the far-right Koch brothers sponsored Tea Party disruptions. And there was another option that was constantly propped up on healthcare reform, which was the public option. So what is the public option? And where in Western Europe or elsewhere does a public option style of healthcare exist? And are you for a public option, or why are you not for a public option? And why, again, it needs to be single payer healthcare the way socialist and FDR, LBJ type of Democrats advocate.
Yeah, this goes back to that question you had about what is wrong from the left with the Affordable Care and what's wrong with the left from the left with the Affordable Care Act. The leftist argument against it is that it still allows healthcare to be held by private interests. It still allows for the privatization and the continued privatization of healthcare, which should be a human right. The Affordable Care Act just was, some people called it a handout to the insurance companies, and you could say that. Despite how much it was beneficial to some extent, it didn't get to the root of the problem, which is that there should not be a for-profit motive in healthcare, period. The public option, in a lot of ways, is a similar problem. If you think about this term, this notion of public option, you're saying, essentially, the quiet part that's not said is that our healthcare system is privatized, but you have a public option. And once you actually say that quiet part, you realize real quickly, this still is some bullshit in a lot of ways. And if you understand American and US private interests, you recognize that there's not really a way that a public option can really, in a sustainable long-term fashion, exist with a private healthcare industry as large and as powerful as what we have in this country. We see this already. We have a couple of public options. They're means tested. So we have Medicare, Medicaid, and so forth, the VA system. They're means tested, and we've seen how each one of those have been attacked and whittled down in a lot of ways. Why? Because we still allow this private healthcare industry to exist. And as long as it exists, it will try to take out and take down any public version that cuts into its bottom line. So in a country like the United States, where you have such powerful private interests that lobby our government and pay folks to pass the kind of healthcare legislation that most benefits their bottom line.
And unfortunately, it's all legal with the Supreme Court. The Supreme Court has made many rulings that says that corporations are people, and should corporations ever take over a state government or the federal government, we should be treating it as a legitimate state, because corporations are
well, it says that the way that they use their money is speech, right? So if they want to donate to certain candidates, that's considered speech because they are legal persons. But as long as you have that kind of power concentrated in a private for-profit healthcare system, the only way that you actually solve the problem and get people covered without there being all of this cost issue that straddles people with debt and so forth, is by getting the private sector completely out of the picture. I am of the mind that it cannot be allowed to remain to exist, because as long as the private sector exists in healthcare, it will figure out how to overcome and whittle down and attack and essentially slowly destroy any public options we have left. What you see in a lot of other countries, like Canada, you see this in Germany, I believe, as well. I'm less familiar with Germany. Let's say Canada for sure. What you see is a public system with a private option. Yes. And that's, if we're going to have any private sector in our healthcare system, that is at least the slightly more sane way to go about it, because you've taken all the power from the monopolistic private sector and you put it in the hands of the public sector, the government, but you still allow the private sector to have a tiny, tiny slice of the pie. They got one tiny little slice of the pie, like 1/8 of the pie, and the rest of it is public run. That's what we should be going for, not a public option. So whenever I hear the Democrats speak about the public option, which is rare, by the way, they only ever bring it up when there's a Democrat talking about single payer public, universal single payer. They never bring up the public option literally, unless there is an actual progressive person talking about universal single payer. Whenever I hear them bring it up, I already recognize that they are clearly bought and paid for by the private healthcare sector, and that they're not serious. They're not serious at all. You can't allow a monster that size and that powerful to retain its power and think, oh, it's going to play fair on the playground with this other thing over here. Sure, that's going to work. We also have seen the public option shut down in California as well. Legislators there have introduced the public option, and the Democrats shut it down in that state as well. So at the state level, we've seen a few attempts from Democrats, particularly, obviously, to bring a public option bill. And then we've seen Democrats and Republicans shut it down. So
but the Democrats also shut down single-payer healthcare bills, like in Vermont, like in California, like in whatever blue state comes up with it. So that's crazy. So,
and they don't have a really good excuse. Like in some states, there's no real excuse. Like, what is their excuse in California? They run the state. Like, so what's their real excuse other than our donors don't want this because our donors are the for-profit hospital and healthcare sector. And let me just be really clear here. The for-profit healthcare sector and industry is bigger than people think. And I say that not to say that I say that mainly to indicate that it's multi-layered. So there's on one hand, the hospital lobbies, right? And they're a big part of that sector, that industry that continually pushes against single payer, right? On the other hand, there's the insurance industry. That's the big one that everybody understands is a big problem in the private for-profit healthcare industry. But then there's also debt collectors, and the debt collectors play a really, really, really prominent role in all the badness that we see in this country related to our healthcare sector. Medical debt is big business. It's big business. And on top of that, we now have healthcare finance, which is a huge player in the space. And you may be thinking, what in the hell is that? Well, there's a such thing as medical credit cards. Yes, indeed. There's a such thing as medical payment products, medical credit cards that people can get to put their medical debt on and pay it off, hopefully, in a period of time so that the interest doesn't kick in. But this is a very big, booming industry. So there are lots of actors in this space. It's not just the health insurance industry that is player that's really driving this. It's different interests. There's even physicians lobbies that are really, really against single payer. So it's a lot of players. But the biggest player, I think probably the worst, is the insurance industry. But don't discount the power of the debt collection folks as well in this space.
Crazy. Well, I think you already answered my question why you're not in favor of a public option. But also, what was the
in favor of a universal single payer across the board?
Exactly. Yeah. And now, what was the issue far-right Republican activists and politicians like Sarah Palin and others, they would talk about this thing called death panels, which I think their argument was that under Obamacare, or even a single-payer healthcare system, where we would that cuts.
There would be these long wait times, and people would die while they were waiting. That was pretty much it. Like, there'd be such a backlog, and there'd be these long wait lines. You want to wait 6 months for your chemo treatment and things like this, which is hilarious because if you spend even a small amount of time in a country that has a single-payer healthcare system of some sort, their wait times aren't that long. In fact, you tell them about some of your wait times in the United States, and they're like, what? It took you that long to get a specialist appointment? Trying to get a specialist appointment in this country, you might call a doctor's office in July. Maybe it's a gastroenterologist, for example, a specialist. And you think, I should be able to get in to see them sometime in late July. The earliest they can see you is October or something like that, right? wait times for specialists in this country are exceptionally long. So the death panels that they were talking about is kind of hilarious because technically you could say that already exists anyway in our current system because there's a lack of specialists within people's insurance networks.
Wasn't the argument, and you can respond if this was a half truth or just full on right wing junk propaganda? Was that cuts would have to be made from social security, so ergo
Oh,
the
yeah, that was
retired and
another.
the elderly, their health care would have to be sacrificed for a single payer system, or the Obamacare system, which is actually a Republican plan because it's actually a version of Romney-Care, correct?
Yeah. I remember there being some talk about there would have to be cuts to certain things like so I don't know. I think they were like there was talk about cuts to Social Security and things like this or something or the other social benefits would have to be like cut back on some, which is hilarious because all they'd have to do is take a tiny sliver of our Pentagon budget and it would cover the whole thing. Right. So and the Pentagon budget wouldn't even fill it. It wouldn't even fill it. So there was just a lot of just easy lies, easy talking points, like sort of like sloganeering that the Republicans were doing that they knew they knew it would work. They knew these little slogans would stick with people, and it was just flat out lies.
Yeah,
From the
and of
very
course all of their and of course all of those protests, all of those Tea Party protests were just astroturfed by very powerful organizations. Uh,
yeah,
Koch Industries, which is actually a
yeah,
fossil fuel oil company, but also the big like well-funded Republican libertarian institutes like the Heritage
yeah.
Foundation, the Cato Institute, and whatnot. But now,
Uh-huh.
but now we have to talk about this, which is, so what is the current state of healthcare in the U.S.? Because I understand when Donald Trump first came into power with an even bigger Republican majority, both locally, nationwide, and federally nationwide. The Republicans, who by then were Tea Party far right Republicans, they had during a key midterm election taken over the House and Senate again, and they had tried repeatedly to overturn the ACA Obamacare, but failed. Even under Trump, who repeatedly ran on, we're going to repeal and replace the failed Obamacare. That didn't
Yeah,
happen. And at some point, Trump, focused on other issues, both domestically and internationally, than repealing Obamacare. So, how
yeah,
do things fare under the Biden administration? What's the future of Obamacare, the ACA, under the current Trump administration, which again has a supermajority in the House, Senate, locally, nationwide? It's all red elephants, and the Supreme Court is basically far right, both socially and fiscally. And I'm
yeah.
waiting in fear when key civil rights, when key clear civil rights legislation starts to go out the window, that the Affordable Care Act will also be shredded. So yeah,
Mhm.
your response
Yeah.
to all it's all it's all what I've just said.
Yeah, when Trump first got in there back in 2017, he figured out or realized real quick that they were going to have to pry the Affordable Care Act from a lot of poor white people's cold dead hands. Because in the summer of 2017, they decided to go full throttle. The Republicans did with trying to dismantle portions of the Affordable Care Act. First thing they tried to do was dismantle the mandate to that everyone have coverage, purchase coverage in some way or the other, and that businesses provide it. And if you remember, that was a crazy summer because various congresspersons who were trying to dismantle the Affordable Care Act were being trapped in their offices as their constituents basically bombarded their buildings. There were congresspersons who could not leave their offices. There were people in wheelchairs rolling themselves into their congresspersons' buildings and refusing to leave.
Yes, I do remember
Um,
that. Yes. I remember that. Yeah,
yeah.
continue.
So the people, and this was mostly white folks. They showed up. This was mostly white folks. These probably a lot of these were people who didn't even like Obamacare. but they recognized that they needed it. At that point, when they saw it about to be taken from them, right, they recognized they needed it. So they ended up sort of backing down on a lot of that as a result. And McCain, if you remember, helped save it, even though he was one of the main people leading the charge to kill it earlier on. And many liberals praised him stupidly.
Exactly.
But
yeah.
yeah, it's like you can't break it and then fix it and then get praised, but I guess you can from liberals. But anywho, but they
John
did
McCain, the
slowly,
overrated maverick, but yeah.
yeah, they did slowly find ways to whittle away at healthcare and whatnot. However, as time went on, we saw a ballooning of medical credit cards. This kind of became much more of a thing in the late 2010s. We saw medical debt still being the main reason that people file for bankruptcy, the stated reason that people file for bankruptcy. So there was still a lot of dismantling that happened and a lot of work that just needed to be done generally because the Affordable Care Act wasn't enough, and never will be. By the time Biden got in there, it was interesting because with the COVID pandemic, there had been this expansion of Medicaid that was probably it was a great example of why we need single payer. It saved so many lives. The number of people who got healthcare coverage for the first time because of the COVID Medicaid expansion package was huge. And then, a couple years into Biden's tenure, they rolled people off of Medicaid. They declared COVID is over, and they essentially rolled people off of Medicaid. So many people lost their Medicaid coverage and lost healthcare coverage entirely because of that. I think there was a reduction in medical debt for a while too, while that was expanded, because it proves that coverage does help limit the amount of medical debt that a person is likely to incur. The number two reasons causes of medical debt is lack of insurance and chronic conditions. It's not that people with insurance don't end up with medical debt. It's just that you are still less likely to end up with medical debt, or you may end up with less than someone who has no coverage. So now we're at a place with healthcare where Biden left office having done one Band-Aid thing that is good, but it's a Band-Aid thing, which is getting his CFPB, the Consumer Financial Protection Bureau, to pass a rule banning medical debts from credit reports, meaning having a medical debt can't harm your credit report. It can't harm your ability to get housing. It can't harm your ability to get a job or a car loan.
Oh, wow.
Wow. Mortgage, right? That's what banning medical debts from credit reports would do. And so he, as he was leaving office, essentially had his CFPB, his Consumer Financial Protection Bureau, working on that. And they finalized that rule and so forth in January before Trump got inaugurated. Well, that rule has now been put on, I think it's been put on hold. There is litigation and lawsuits already filed from the healthcare for-profit industry, as well as advocates who are trying to save the rule and keep the rule in existence. It's a Band-Aid, but at the same time, it is one positive thing that Biden did related to health before he left office, or I should say the administration under him did before he left office. And it is one thing that would be really terrible for us to lose, because there's not really any other great things that he did related to healthcare. What we see though in the United States is, while the federal government has been basically asleep at the wheel or not giving a shit about healthcare issues, states have had to take the lead.
Interesting.
And so what you see here is a lot of states have passed medical debt and healthcare protections to ensure that people have better access to insurance, to reduce medical debt generally, to prevent medical debt from showing up on credit reports, to prevent doctors' offices, particularly dental offices, from offering people medical credit cards while they're under anesthesia, things like that. So states have had to take the lead. And so now we're kind of in this weird no man's land where it's kind of a state by state thing, what kind of protections you might have as a patient, what
As
kind
the
of
future,
and
uh,
unfortunately, the states where the majority of Black people are clustered aren't those states that have taken these steps to protect patients, except for Louisiana and North Carolina. So
before I get to this big sort of last question slash discussion, and I do have to ask this. So, do you think that the future of the ACA slash Obamacare is what it goes back to the very beginning of our conversation yesterday, where you say it's great we have Medicaid. It's even great we have Medicare for the elderly folks who, when they retire, they have both Social Security and Medicare. But because of this crazy capitalist, libertarian, neo-Keynesian system, which is the United States, it's you'll have situations where in Massachusetts you'll get easier access to Medicaid, but a place like Kansas, you don't really get access to Medicaid. In California, it always depends on your income, how great, your insurance, how corrupt they are, and how generous your job is. So is that just going to be the future of the ACA, where it still is this for-profit system, but some states are just better at doing it compared to other states, compared because of the avalanche of for-profit healthcare systems, which would
I think that's
that
I
you
think
mentioned
that's
in the previous question.
yeah, I think that's fairly accurate. It's going to be a situation where one state over, you might have really good access to charity care and free care at their nonprofit hospitals. Even if the Affordable Care Act federally has been whittled down, that state maybe has actual state legislation requiring nonprofits to provide free care to people who are low income. So you may be good in that state. The other state over, nope. They don't give a shit about whether you have access to healthcare. So they haven't mandated their hospitals provide it to people at a certain income level. You may be in one state where your insurance coverage networks is broader and better, so you have more access to more doctors and whatnot. And then the one state over, there's very few specialists and doctors that you have access to. It's very much, you may be in one state that says, no, medical debt cannot show up on credit reports. And then next door, medical debts are still allowed on credit reports. You still see people losing housing, the ability to get housing or whatever because of medical debts. We're really in a moment where the worst nightmares of those of us who understand that the Federalist Society is the enemy, and the biggest dreams of those who agree with the Federalist Society have come true in a lot of ways, where state by state, what rights you have as a human being can differ. We already see it with abortion, right? For example. So, and I don't know that will change going forward when we have a federal government that is run by a duopoly that is basically bought and paid for by the same interest.
Exactly.
Ultimately, we have Republicans who want to do everything they can to make total hell on earth for everyone here, and we have Democrats who want to basically try nothing and throw their hands up like they're incapable of helping at all.
That's a perfect segue to this question, and I think now and big discussion that we have, which is this: how is it the U.S. hasn't managed to get a single payer healthcare system passed? How is it Democrats, even in states that vote mostly Democrats with Democratic mayors, local councilors, Democratic governors, and huge Democratic majorities, haven't even locally passed a single payer healthcare system in California, New York, Massachusetts, Vermont, where Bernie Sanders is a rock star alongside other left-leaning or old-school liberal Vermont Democrats, or a place like Chicago or DC or Maryland, with places like Baltimore. There
And
has
Maryland's
been
actually a
a
really
simple
good
bill.
state in terms of healthcare too. But yeah,
Yeah,
um,
there hasn't been a simple bill that simply says Medicaid for all or Medicare for all, modeled and even muddled the bill the way veterans of healthcare get their healthcare and their families for life. How is it?
well, just veterans. The veteran system.
Actually, so how is that? Because I do have to say this. I even prepared this statement. Americans aren't stupid. Americans do travel, many on business trips, others for recreational purpose, and there are Americans of countless diverse backgrounds, even Americans who have had to work overseas. They've lived under a single payer healthcare system, a public option type of system. How is it none of these Americans, when they come back home, they go, guess what, guys? I bring you incredible news. Let's adopt the Canadian or Australian or French healthcare system or
Yeah,
the old school NHS to whatever country they live. And then, so
I
yeah,
think
your
I
response
think
to all of that.
the answer to your question is really, really, there are many answers. There are a couple of very obvious answers. One, lobbying by corporate interests is the main thing that has prevented us from having a universal single payer system. And I keep emphasizing universal single payer because I want Americans to understand that we have single payer systems. We have them. They're just not universal, and that's the problem. But that's what's stopping corporate lobbyists in the healthcare space are the main blockade against the people in terms of us ever getting a universal single payer system in this country. The other thing is the general hyper individualism of Americans. We have met obvious conservative libertarian type Americans while traveling to for instance, Ecuador one time, who was down there essentially because of the healthcare, talking to us about, oh yeah, the healthcare here in Ecuador is great. It's paid through your taxes and comes out of your paycheck and whatnot. It's very small amount every paycheck or something like that. And anytime you need to go to the doctor, you're good to go. You don't have to worry about any cost. Meanwhile, this same person is a Trumper or a Republican. And so they're still voting back home and they're voting for everything that's the opposite of what they're getting in this other country. Because I think for a lot of people, it's a matter of, I deserve this, but all those people don't deserve it. All those lazy people who don't want to work and all this don't deserve it. The hyper individualism is such a killer in this country. It is what has prevented us from getting so much of the good things. And the hyper individualism is absolutely founded and steeped in racism. Anytime people are talking, and anti-Blackness in particular, which is why I wanted to have this discussion with you during Black History Month, because I don't think that when we talk about racial justice, we talk about healthcare enough, and our healthcare system and single payer enough. It's not that single payer will solve all of the healthcare system problems that Black folks have. We still have problems with just quality of healthcare. Even in places in other countries, there's still a quality issue that for Black people, for Black patients. But it would go a long way towards resolving a lot of the healthcare disparities that you see with Black folks. Because a lot of Black folks just avoid going to the doctor because they don't want to deal with the bill that they're probably going to get, or they have no health insurance at all, since Black folks are more likely to be uninsured than other groups. Right. And we lack the wealth that white folks have to be able to deal with a $5,000 medical bill that lands in our lap. We might not be able to tap on Auntie's shoulder and ask her for, $5,000 to borrow, or tap into the trust fund or whatever. Right. So the problem really goes down, to answer your question, is what is stopping the United States from having a universal single payer system? It is corporate lobbying by the healthcare for-profit sector. It is hyper individualism and a sort of, I only care about me, and those folks over there haven't earned it, they're lazy. And that hyper individualism is 100% steeped in and founded in racism, specifically anti-Blackness. Those are the reasons we don't have.
But then, I it really infuriates me. It really, really boils my blood to see so many Americans who have worked overseas, who have traveled, and they go, "Wow, you mean I don't have to tip everybody when I go to restaurants?"
Learning that tipping was literally about racism shocked me. I was like, everything that obviously seems kind of stupid in this country and backwards, it's because of racism every time. But tipping.
But I find that fascinating in and of itself, because you mentioned these, these conservative libertarian types in Ecuador. My friend Saeli, who's part of Orinoco Tribune, which covers Latin American affairs and international affairs. She was telling me that there are countless stories of Americans who go to Mexico constantly because they know that they're going to get free treatment or very low-cost treatment for whatever is their medical issue. And do they come back to the U.S. and go, guys, there's a better system out there, single-payer healthcare system or a public option system, the way they do it overseas in a Latin American country or European country or an Arabic country. And then she says that, nope, they don't. They come right back across the border from the plane or from the car and shit actually all over the Mexican system. So my other big question is the US doomed, actually?
Like, are we just fucked? Yeah. I mean, at this point, it's hard to say we're not. I always hold out a little bit of hope because I know that you can only push people so far. That said, I did read at work today an article from a conservative site that I posted on social media about why we need to transition our healthcare system to the retail model. I shared this article because I wanted people to see this is literally how the majority of our politicians think. And I think it's interesting because the majority of regular people, I think, would read that article and be like, what the hell? No. But they don't realize they're voting for people who think like that, who are paid to think like that. So it's hard for me sometimes to say, no, we're not totally doomed, because I can see all of the dark money interest and how powerful they are and how much their power really eclipses the power of individual people. But it's that individual part that I hang on, because yes, the power of that industry, that these corporate lobbyists, is very much way larger than the power of individual people here, but they're not more powerful than us collectively. And so my hope is that at some point, we can get better organized. I'm not looking for some random event to happen and then there's a spark, because that's never how it happened. This kind of change that's necessary requires deep organizing for long term. But my hope is that we can get better organized, even just a small percentage of us, because it only takes a small percentage of people to change a culture, to change a society.
As Ralph Nader says, breaking through power is easier than we think.
And move things to the left. It's a small number of these people in power who are changing, who have, completely dominated our culture and changed things and so forth. So it can also be a small percentage of us to do the same thing in reverse. But so that's my hope. My hope is that a small enough percentage of us give enough of a shit and understand well enough that something needs to happen, and that we're willing and have the patience and the passion enough to actually try to organize, to make it reality.
But isn't the other major problem, isn't one of the big problems in the U.S. While I understand no one wants to pay high taxes, but isn't the moment that enters the equation, the rich, especially the middle classes, the bourgeoisie, don't want to pay and invest in a single payer healthcare or a public option, and
It's all about the way you phrase things to people.
Okay.
I've had these conversations with folks because and just in this work generally, I'm always trying to figure out like what are people really thinking. So I've had these conversations with folks, and I've realized that the way you phrase things has a lot to do with the kind of answer you're going to get. So I've had a conversation, for example, with a social worker. The social worker that I was mentioning on the previous call, who was like, "Well, if we have free healthcare for everyone, you're going to have people pulling up in Hummers getting free healthcare. It's not like they can't pay for it." That same social worker, I asked her. I said, "All right, let's pull back. Would you rather have a system where your healthcare is always covered, pretty much 100% with almost no out of pocket, through the money that's taken out of your check via taxes, every paycheck? And let's say that money that's taken out of your check, every paycheck via taxes is, let's say it is $100. Maybe it's $100. But that $100 is what is taken out. And every time you go to the doctor, you never have to worry about a bill. You never have to think, oh my goodness, this could bankrupt me. You never have to think, oof, can I afford this while keeping my lights on? Right? You never have to think, I should just sit here and deal with this pain because I don't want to end up with a bill. Would you rather live in that world? Or would you rather have a world where you have to pay for insurance that covers very little, and you have to always worry about those things, but oh boy over here with the Hummer won't get free health care, right? And the conversation changed, because unfortunately, you have to play to the hyper individualism a little bit. I played to the hyper individualism. I said, let's think about you for a second. Don't think about him. Let's think of this is the imaginary him. Think about you. How would you feel if you always could go to the doctor and just never have to worry about losing your literal house because you got sick? And she said, okay, you're making good points. You know what? She's like, wait a minute, that kind of like, that actually is possible, was her reaction. And I was like, yeah, it's literally the reality for people in most other countries outside the United States. And, I talked a little bit about living in London for a very short period of time. And just having these healthcare conversations with people whenever I travel outside the country. And I said, look, you don't even have to care about other people. I said, care about yourself. Turn this into a selfish issue. And it changed the conversation. So I really think it's about the way you ask the questions and about the way you comment at people. I think because we're in a very selfish country with a lot of very, very selfish and self-centered individuals, you have to come at them on a selfish level. You really do. You have to cut them off immediately when they start saying things like, well, some lazy people. No. You. What do you want your life to look like? What do you want your life to look like? That's the key.
I got two more questions. Second to last question is, do you think, if lucky, you'll be able to not only get in your lifetime single payer across the finish line, and one that includes dental care, mental health care, and eye care?
Now, let me just say what my dream is, first of all, and then I'll answer whether I think I'll ever see it. The dream is a single payer, universal healthcare system, publicly funded health plan that is administered at the state and local levels with comprehensive lifetime benefits, which includes dental, vision, mental health care, substance abuse, treatment, prescription drug coverage, hospice, and long-term care.
Oh, so pharmacare as well, then.
Yes. The whole smorgasbord, a lot of the stuff that even in other countries isn't covered under their single payer. That's the dream, all of that. We can actually use what other countries have done and then do better if we really want to, right? So that's the dream. Will I ever see it in my lifetime? I'm 40. I hope. But I can't say that I will, because I don't think that the folks that are in this work are recognizing the need to organize more effectively, and to change their messaging and actually learn how to appeal to the selfish interest of people. I know that a lot of leftists really, harp on about the need for collectivism and the need to emphasize collectivism, and I'm one of those. I agree with that. I do think that sometimes you have to take the short-term win of appealing to people's selfish interests in order to get to the long-term win of collectivism, right? You're not going to get people who are very, very individualistic to suddenly just care about everybody else. We saw that during COVID. Folks just wouldn't even mask. The simplest thing, they wouldn't even mask for other people. Because why? Because it was messaged initially that you should mask to protect other people, not to protect yourself. And then eventually they changed around. They said mask to protect yourself, but the message was already received, the previous message.
And in fact,
the answer is,
and COVID, I'll just say this very
yeah,
quickly. COVID really did show just how deep the libertarian mindset goes, because
the
I even know many lefties and many left-leaning people who were COVID minimalist denialists. But anyways, continue on.
Yes, it was so clear with a lot of leftists even that the individualism was just too deep. So you have to start there, I think, with the individual selfish motive to get to the collectivism in a country like the United States. We're not in Ecuador. I was talking to people in Ecuador and they were like, sure, I want my neighbor to be covered. I want everyone to be covered. I want us all to be healthy. Don't even bother trying to get people to feel that way in the United States in the beginning. You're going to have to take baby steps to get there, right? So I do, on one hand, feel somewhat hopeful because I think these things are talked about more than they used to be. And I credit Bernie with that. I credit Occupy with that. I credit the Black Lives Matter movement with that. There's a lot of things that really kind of came together over the past 20 years that has brought these kinds of conversations about health justice and healthcare and single payer to the forefront. And Obama, actually, because he talked about single payer and then he got in there and didn't do it. But it put it in people's heads.
In fact, he even excluded all the people who were single payer healthcare advocates the moment he got into power.
But it put it in people's heads. It put it in people's heads and it put it in the mainstream consciousness in a lot of ways. And that's good. That right there was good enough in some ways to at least maybe move the needle. So on one hand, I think there is some hope because we're talking about this stuff more than we ever used to. But I'm skeptical that I'll ever see it in my lifetime because we are far from recognizing the need to do deeper organizing and to rethink the way that we message. We're far from that.
And also goes to show you that the duopoly, money, which is the root of all evil, is a big obstacle to even the most basic fundamental reforms and change that needs to happen. Yeah. I have to broaden this to the international level. John Pilger, may he rest in peace, in his very last documentary was about British domestic issues, and he did his second documentary on the attacks on the NHS. In his documentary, The Dirty War on the NHS, he spoke to American single-payer healthcare advocates who also appeared in Michael Moore's Sicko.
Mm-hmm.
And Dr. Linda Pino said the following, and she's speaking directly to the British public and to John Pilger about warning them about privatizing the NHS and adopting the US-style system. She said the following, and I'm going to try to do my best to quote and paraphrase her, but she said the following. She says, if you already start at a system of values that is to take care of one another, that core principle, you've already started on the foundation of values. I mean, in the US, we've never really had a healthcare system that started off with the core value of healthcare being a right and all of us looking after one another. You do. You already have started off on that, and once you lose it, you will never get it back.
I think that's an interesting counter argument to the strategy that I noted, actually. And I'm not inclined to disagree. I think before COVID, I would have been 100% with that entirely. Like, we have to start out with collectivism. We have to start out with the value statement that healthcare is a human right and that we all deserve it, not just me, the individual. But COVID just sort of like really switched something in me. I realized that people, as soon as you message to them that they need to do something to help other people, they just, the level of care that you're going to get is is diminished, if not entirely gone. And that maybe you actually do need to start from a point of me, in order to get to the we. And one thing I appreciate about Bernie's 2020 campaign is that he had that collectivist statement that I forget how it went. It was something about we, something. I can't believe I don't remember it because I thought it was so great.
Yeah.
And it really resonated with millennials and Zoomers. Like, it super resonated with millennials and Zoomers.
Was it sort of a version of Jeremy Corbyn's for the many, not the few, or something like that?
Yeah, it was the simplest slogan. 2020 slogan. It was the simplest slogan. What was it? But it was not me, us. There we go. Not me, us.
Interesting.
It was a great slogan. And the thing about it is, part of me knew it wouldn't work in the United States. I knew it would work on certain generations. So it worked with millennials and it worked with Zoomers. It did not really set and work with Gen X, with Boomers. So it basically didn't register with at least half of the voting population. It's the point I'm making. But it was idealistic. It was something that we should be striving to. And for that, I was thankful for it. But part of me knew, oh, this is not going to work. It's not going to work. Not me, us. So I would have agreed with her and her assessment about the strategy that we should be employing message-wise prior to 2020 and COVID. But something just became very clear with 2020 and COVID that is not going to work on the US population. I could take that message, that particular strategy, to Ecuador and to a lot of other places, and it'll work. Like I said, in those conversations I had with people in Ecuador about healthcare, that's how they talked about it without even being prompted. They were like, well, we want to make sure everybody has healthcare, not just me. We want us all to be healthy. And they're looking at me like, why wouldn't everybody think this way?
Well, I think
I think this way for most of my, a lot of my compatriots in the United States.
Oh, but I think it also goes to show you, America. By the way, I just have to say, America's not unique in its right wing,
No.
visions and so forth. But I do have to say this about the American right. They are very unique in that they even believe that healthcare should not be a right. Where you do,
yes,
where British Tories who have been involved in privatizing the NHS, they would never. And the Australian right wing and the Canadian right wing, and of course the French right wing.
Well, you know why they would never.
They would never ever flirt with the idea.
But you know why they would never
saying, let's privatize healthcare and so forth.
But you know why they would never have the take that the Republicans here have is because you said it earlier. That value already exists within the population of those countries. This idea that, yeah, I'm fine with my taxes going to make sure everybody has healthcare. That value is already there. So they know that if they say something totally counter to that value, they've already fucked themselves for the most part. Nobody's taking them seriously if they go totally counter to their value. So they got to try other little slick ways to get around it, right? And whittle away the systems that are in place there. Here, that value doesn't exist, that we should just help each other. So the Republicans can just have the mask all the way off and talk about how we don't need to care about these people or those people.
In fact,
so when people say that American exceptionalism doesn't exist, I agree. There's no exceptionalism when it comes to the United States. But there's one way in which the United States is very exceptional. The hyper-individualism. I don't know that there is another country that is more hyper-individualistic than the United States. And it is, like I said, it's steeped in racism, that hyper-individualism. But I think that is where the American exceptionalism actually exists.
Yeah, exactly. And I think Britain and Australia sometimes gives America a run for its money. But I think important, but also this is very important advice to Americans who are asked to do solidarity work overseas or voluntarily go and do solidarity work overseas to any country, from a rich one like Luxembourg and Switzerland to a poor one like Estonia or Latvia, or any country in the Caribbean, and African ones and Latin American ones, to any Asian one from Japan, Mongolia, Nepal to Lebanon or New Zealand. in Australia, which is this. When the country talks about healthcare reform, when they talk about modernizing their healthcare, which is a red flag of adopting the American ultra-free market system, and they bring
Yeah.
experts from the American and from American health insurance companies or their lobbyists or propagandists to make the case to lawmakers that they should reform their system to adopt to adopt the American one. My advice to my advice to those Americans is to simply warn them about the American system. And when they go back to the US, don't overlionize how wonderful the
Yes.
German, Belgian NHS is, because what that does, it's counterproductive for the left movement there, who are trying to warn people that, guys, they're trying to privatize healthcare. Their reforms is a bunch of free market nonsense. And I find too often leftists like Michael Moore and Ralph Nader and others overlionize the NHS in Britain or in Canada and Australia, when all of those countries are actually, because of lazy journalism and complicit journalism, are actually trying to cover the regressive free market radical reforms, which are actually happening across the world. So
that's why you didn't hear me talk that much about those systems. I am very big on emphasizing the single payer systems we already have here, because I'm like, let's just expand those. Like, they work. They need some tweaking and they need a little bit of, refining and so forth, but we have them already and they work. We don't even have to talk about, Scandinavia and all these places when it comes to various socialistic ideas. We already have a lot of these things in practice. We just means test the fuck out of them is the problem. And we allow the private sector to whittle away at them. So let's just get the private sector out of there, But I totally agree. It's very counterproductive for Americans to come back and overly lionize those systems. And the best thing we can do as Americans is warn everyone outside the country, please don't be like us. Do not be like us. You don't want this kind of exceptionalism. You don't want it. Don't be like us.
Exactly. So, and it's also important because I to our audience, which is an anti-imperialist audience, the imperialism of America and its allies, the Pan-European alliance and so forth, NATO and so forth, America doesn't just impose hyper capitalism on the world, but also through the IMF and whatnot, and even when they overthrow countries like Saddam Hussein's Iraq, Assad's Syria, or what they're trying to do in Venezuela and elsewhere, is also to privatize the healthcare system there. If a country, if even in countries where on paper they are supposed to have a single payer system or a public option type of system, they cannot do it because through American, Canadian, and Pan-European imperialism, they actually make sure that all of those countries, whether it's in Africa, Latin America, and so forth, do not get a healthcare system. And a lot of that, you were talking about how so much of the unjust healthcare system in the U.S. is linked to white supremacy. It's also linked to global white supremacy and this
linked to colonialism
system that is capitalism.
Yeah, this all goes back to colonialism. One thing I'll leave with is that if you really, really want to understand why even a single payer system is not a universal single payer system isn't enough to resolve the crises that we see at the heart of every Western country right now, you really should read Walter Rodney's How the West Underdeveloped Africa. There's a particular chapter he has specifically on the ways that these Western countries depend on the scarcity that they create in other countries in order to even give their population tiny little crumbs and whatnot. And those crumbs can be single payer systems, paid family leave and things like that, certain workers' protections and so forth. It's so important to understand, for leftists to understand how colonialism and therefore white supremacy is at the heart of every single one of these problems, and that The workers could uprise tomorrow, and that still ain't gonna change the colonialism and white supremacy at the heart of all of this. We have to do all of these things together, and we have to be thinking about them together, not separately.
And it's also why Black people, Latinx people, Indigenous people, and the 2S LGBTQIA community needs to be in the front lines. As the documentary I saw about that I was rewatching about the Black Panthers, we have to be at the vanguard of the revolution.
Oh, absolutely. We need to be the main voices leading this, because at the end of the day, we're the most impacted. We're the most impacted, globally and obviously domestically in the United States.
Exactly. Well, we were joined today on this epic edition of 1+1 with Berneta L. Haynes, who is a longtime consumer rights and environmental lawyer. She's also a sci-fi fantasy author, as well as a Black leftist, and the best of the Black left because she's an abolitionist, a queer liberationist. She's the B in the 2S LGBTQIA plus community, bisexual. She's a feminist, an anti-imperialist thinker, and she's long worked in helping the fight against the long-time epidemic of unpayable medical debt, which has left countless American families not only bankrupt, but in destitution. And Berneta, thanks so much for coming back on the program and always being a returning champion. And all my best to the good work that you constantly do. And you're certainly one of the countless heroes, heroine unsungs, and all my best to you. And look forward to having you back when the time comes. And also, this was our 300th episode, Berneta.
Oh, awesome. Well, thank you for having me on to celebrate that moment.
Exactly. Yeah. So this was our 300th episode. So reminder, folks, do donate generously if you can, and of course share widely. And again, Berneta, thank you so much for coming on the program. Always an honor, and looking forward to having you back. When the time comes.
Yes, thank you for having me, and congratulations on the 300th episode.
Thank you.